Brooklyn Independent Television.
Though the teens we've just been discussing could never imagine it, they will someday reach middle age, and the girls will become women facing menopause. In terms of a threat, hot flashes don't compare to STDs, but they can be tough to live with. Healthbeat Sherry Carabin met a doctor whose practice focuses on menopausal women. He advocates the use of natural hormone replacement therapy, an approach that's questioned by many medical professionals.
I was a mess. I came in, I think my biggest complaint was that I felt like everything was foggy.
It has been more than 10 years since 54-year-old Cindy Salzillo first began experiencing the signs that she was approaching menopause.
My symptoms started when I was about 43. I started feeling different things.
Such as?
Irregular periods, mood swings, very bad mood swings.
Cindy was going through perimenopause, the stage leading up to menopause, when hormone production begins to drop, sometimes fluctuating greatly, causing varying degrees of symptoms ranging from hot flashes and mood swings to insomnia and a decreased sex drive.
Did anyone believe that you were going through anything?
No.
Not all women have severe, obvious changes as they go through their menopause transition.
Dr. Michael Abrahams is a board-certified obstetrician and gynecologist at Brooklyn Women's Services in Bay Ridge and an attending physician at Maimonides Medical Center. He's also a nationally certified menopausal practitioner.
By definition, 1 year without having a period makes you finally menopausal. The average age of menopause is between 51 and 52 years old. That's the average age in the United States. It can start as early as 45, or in rare cases, as early as 40.
I like those boots. Go back, those white ones.
In Cindy's case, her symptoms started before she was 45 and proved to be quite disabling.
Very bad hot flashes. This malaise that is pretty common with menopause. You feel foggy, like you're not really here. Like things are happening around you, but you're not included in them. Especially when I was driving my car. Would you like a cup of coffee? Okay, I thought you would.
There are about 30 or 40 classic described symptoms of women who are going through the menopause transition. Some of these can be managed behaviorally, but there are some symptoms that cannot be fixed except for the replacement or the balance of their hormone levels. Traditionally, the form of hormone replacement therapy has been two highly marketed products. One was called Premarin and one was called Provera. And the combination of these two in one pill was called Prem-Pro. Both of them were synthetic alterations of the human estrogen and progesterone molecules.
While hormone replacement therapy can relieve the symptoms, it may have side effects. In addition, studies show it can increase a woman's risk for breast cancer, stroke, and certain cardiac events.
Currently, I only use estrogen therapy and progesterone therapy that match the human estrogen and progesterone. This is a bioidentical hormone product that's available through pharmacies. Bioidentical has become a trademark name, but what it means is that the structures of the hormones that you are giving are the equivalent of human progesterone and human estrogen.
Waterproof suede upper. I like them.
After an unsuccessful years-long search for relief from traditional drug therapies, Cindy decided to try a different approach.
A friend of mine gave me the Suzanne Summers book, and I read 3/4 of it. And I decided I had to do something about it, and that's how I found Dr. Abrahams.
In her case, she has a patch and uses creams to deliver the bioidentical hormones. And you just put it on your arms.
And the thinnest skin.
And then you just rub it?
And then you rub it together.
And that's
goes
it?
into your skin, and that's it.
Although it's only been about a year since she started natural hormone replacement therapy, she says her symptoms are essentially gone.
Except when I drink a glass of red wine, hot flashes, you know, the patch can only do so much. I saw some negative things about it. I took them into consideration. But now that I'm on it, I don't think there could be a negative thing that would stop me from doing it, from continuing the treatment.
Indeed, the American College of Obstetricians and Gynecologists issued this statement. Despite celebrity testimonials touting scientifically unfounded benefits of compounded bioidentical hormones, the bottom line is that most have not undergone rigorous clinical testing for safety or efficacy, nor are they approved by the FDA.
What they frown upon is the non-regulation of compound pharmacies. There are compound pharmacies that are strongly regulated. A lot of bioidentical products are now partially available through standard pharmacies.
So what do you say to critics who argue that there's no evidence that bioidentical hormone therapy or natural hormone replacement therapy actually works?
What they say is that there have been no studies on these natural hormone or these bioidentical hormone products. But in truth, there have been no studies on hormonal products at all. There have only been studies on these drug-like therapies, which are not human hormones.
As the debate continues, this doctor says he doesn't plan to change his approach.
There's plenty of anecdotal evidence that patients feel better on these products.
This is Sherry Carabin reporting for Healthbeat Brooklyn.
Become a fan on Facebook, like Brooklyn Independent Television.